Good evening, everyone. Thanks for joining us. We're very excited for everyone to join this conversation with some experts in the field of discussing workplace breastfeeding support in Kenya. Given that we have just had International Women's Day and it is currently Women's History Month, we feel like it's very topical for us to be discussing this month. So we have a panel of experts with us, and I'll let them introduce themselves to you. And as you have any questions for us, as any comments come up, please feel free to comment on LinkedIn or Facebook, whichever platform you're watching from, and we'll get this discussion going. So perhaps we can start with Irene. You can introduce yourself, what your title is, your organization, and what role you play in providing breastfeeding support or encouraging others to provide breastfeeding support at the workplace.
All right. Thank you, Sahar. Good evening. Please give me a thumbs up if you can hear me audibly.
Sounds great.
All right. Perfect. My name is Irene Kimashia. I head corporate affairs and communications at the Institute of Human Resource Management. At IHRM, we are the regulators of the human resource profession in this country. We have a membership of over 18,000 strong HR professionals across the country in different sectors. And what we do to promote breastfeeding support at workplace. HR professionals are responsible for policy formulation and implementation at the workplace. And HR professionals also drive the culture of an organization. So what we do as IHRM is sensitize HR professionals, build capacities, collaborate with stakeholders like yourselves, just to raise this awareness and support them, whether it's by developing policies, by just giving them the information they need on where to, get support and set up the lactation groups. So that is what we're doing for the community through sensitization, capacity building, and creating awareness. Thank you.
Amazing. Thank you, Irene. It's great to have you here representing the IHRM. Maybe Faith, can you go next, representative from the MOH?
Yeah, my name is Faith Getahi. I'm a nutritionist consultant in maternal, infant, and young child nutrition. Currently, I'm with the Ministry of Health, a member of the MIYCN Technical Working Group. And among them, there are many task forces. So I'm also in the task force for workplace support for breastfeeding mothers. And what we do there is that we come up with the policies to guide in terms of establishment of workplace support. We come up with the policies and guidelines, and we also do training for the national trainers of trainers in the various areas of maternal, infant, and young child nutrition.
Thank you, Faith. It's great to have someone from the task force here with us, as you've been working on this for a long time. Finally, we can go with Millie Karina, or as we like to call her, Shuru.
Yeah, thank you, Saha. Good evening, everybody. Good afternoon, wherever you're tuning in from. My name is Millie Karina, and I'm a proud nurse midwife, and I happen to have the privilege of being a board-certified lactation consultant, heading Kenya Association for Breastfeeding as the chairperson. Kenya Association for Breastfeeding is an association of members that has lactation professionals who support and educate women through breastfeeding in the community. We also are part of some advocacy and ensuring that we promote, protect, and support breastfeeding. I'm excited to be here and to be part of this discussion. Thank you so much.
Great. Thank you all so much. I'll introduce myself. My name is Sahar Jamal, and I'm the CEO and founder of Maziwa, which is an organization which is based on the mission of ensuring mothers no longer face a trade-off between going back to work after giving birth and breastfeeding their newborn optimally. We do this by our launch of the Wema breast pump, which has been in the market for 2 years. It's a discrete, wireless, and portable pump that can be used in any workplace environment. We offer a corporate package for employers of breastfeeding mothers to support them better. And we recently conducted a survey in partnership with both Kenya Association for Breastfeeding and the IHRM regarding workplace breastfeeding support in Kenya, and we're going to share some of those results on this call. So we're very much looking forward to this conversation. I think, as you can see, many of the people on this panel are experts in the area of breastfeeding and workplace support. But for those of us in the audience who may not be as familiar with what are the challenges for breastfeeding women and why is it so important for companies and employers to support breastfeeding moms? Can each of you share from your perspective why you believe that it's so critical for HR managers and companies to care about this issue? And maybe we can start with Millie this time. And from your perspective as a lactation educator, why is breastfeeding so important for mothers, children, and society?
Thank you, Sahar. As a lactation consultant, I highly advocate for the support for mothers in the workplace, because we tend to bombard them with information when their child is an infant, and then they go back to work, and they're expected to ensure that they breastfeed for up to 6 months. But many a times that's impossible, exclusive breastfeeding for 6 months, because when they go back to the office, then they have no time or a space to express their milk. So this leads to a lot of women not turning up at work. Others, they quit. Others are just absent because they are unable to meet the demand of being a mother and at the same time being at the workplace. But if they are supported, if they're empowered, then they have higher rates of staying in the workplace. They have higher retention rates. They are happier. They feel supported, meaning they have a higher employee morale. And there's also the work-life balance. With the work-life balance, and the mother is able to, yes, be a mom and take care of her children, but at the same time be a professional at work and actually do the best that she needs to do. And there's also ensuring that we're complying with the Health Act of 2017, which Section 71 and 72 says that we employers need to provide a space, a good, comfortable space for employees to be able to express their milk, store their milk, and even breastfeed their babies if they need to. And ensuring these mothers also are aware of their rights in the workplace, that they have 1 hour of protected time to ensure that they can use that 1 hour how they want to be able to successfully ensure that they are going to feed their babies exclusively for 6 months and beyond, even up to 2 years and beyond. But I know the act is for about a year, but it will ensure that the mothers are happy, because the most important resource is the human resource. So we need to take care of mothers in the workplace. Thank you.
Thank you so much. And I know you've alluded to areas that both Faith and Irene, I'm sure, are passionate about. Maybe we start with Faith. From your perspective, in the task force that you're working in, why do you believe it's so critical for employers to focus on workplace support specifically? And how is that going to enable mothers to continue optimally feeding their children?
First and foremost, we know that breastfeeding is recognized as a human right. And for babies, they need to get the basic nutrition. They need to get shelter. They need to get good health care. And this is well stipulated in some of the policies that we have come up with. For example, under our Kenyan constitution, we know that every child has a right to good nutrition, and every person also has a right to be free from hunger and adequate food for acceptable quality in terms of economic and social rights. So what we are saying here is that it is important to support mothers to exclusively breastfeed, because breastfeeding is a right for that child, so that that child grows to be a child who is later productive in life, will be part of that human resource, because the child has grown optimally, having made sure that his brain grows to full capacity and contribute later to this society and be productive.
Absolutely. Thank you, Faith. And Irene, from the company's perspective or the HR manager's perspective, I think some of these benefits were alluded to earlier, but what are the benefits for a company and why should they care about this?
Thank you so much. I associate with the comments of my panelists, colleagues. And why do I say this? We are talking about women in the month of March, and we're also talking about diversity, equity, inclusion, and belonging. And if somebody is looking at the bottom line, having a diverse workforce is not only the right thing to do, it is good for business. And women are a critical mass of that workforce. They are a critical aspect in terms of contribution. So if you're looking for a business that is thinking strategy, that is thinking making profits, then you need women and their skills, their capabilities, their giftings, which are totally different from men, never mind their competencies because they're experts in their different fields. But saying that, when you come to work, you bring a whole human being to work. 3 months after you've had your baby, you leave the baby at home, and if you're lucky enough, you have support, then you come back to work. You do not leave the mother at home. You do not leave your breasts at home. You come to work with the whole of you. You know, I've had scenarios of where mothers have had to express milk in the bathroom because they're getting uncomfortable, it is painful by their shoulders, they cannot type. That means they're not productive. If they're in a meeting, they're having a headache. For those of us who have had the opportunity to be mothers, which is a blessing, um, 2 years on, you're still figuring out what is going on. You know, leave alone 3 months when you have had to leave a small, vulnerable baby with somebody else to take care of. And then you go back home and then you do not have a good night's sleep because you have no milk to feed your baby because you expressed it into a sink in the office. So if you're an organization that is also looking at, growth and benefits, how is this employee going to contribute? So if you're thinking strategy, if you're thinking well-being for the mother, for society, mental health and well-being has become a thing. If this mother is not well, their child is not well, by extension, their family is not well. So it is good for society. So workplaces need to have the right policies, have the right attitude. There is a perception that having a lactation room or having some of these provisions is expensive. It doesn't have to be. And I'm glad Faith is here. The guidelines actually provide the minimums of what you need in an office space to have a safe and secure space for a lactation room. So I think for employers, it is important that we view this as an investment, which has a return because then your employees, who are a significant number, who are mothers, will be able to stay on. They will be productive. That means a reduced rate of attrition and turnover, and that means managing costs that you would use in recruitment. And it's no longer even possible to say we're not hiring women or women of childbearing age. That is not even a conversation we are going to have. So you will have these women. It is good for your business. Support them to support your business. Thank you.
Incredible. Yeah, sounds like a great business case for it as well. I think that you've covered a lot. The only thing I will add is that, we often think about breastfeeding as the responsibility of the woman and the responsibility of the mother, but really it needs to be the responsibility of us as society. These children that we're talking about who are going to grow up to have greater cognitive development, higher earnings, this is the future generation of Kenya. So every single individual should be passionate about breastfeeding support. And it's not just a woman's issue. And we should be supporting and celebrating these women for the responsibility that they're taking on, as opposed to, making them feel shameful about returning to work or penalizing them during this journey, because they're taking on such a great responsibility for our community. So I absolutely agree with everything that you're saying. So now that we understand why it's so important to support mothers at the workplace, maybe we can share a little bit more deeply, to your point, the policies and the guidelines that do exist. So as a mother who's a working mom, what are your rights? How can you ask for your rights at the workplace? And as an employer, you understand what are your responsibilities and what are you supposed to be working on exactly, and how are you supposed to be improving your workplace so that it is more suitable to working mothers.
Can I talk?
Yes, absolutely. I'm sorry, I didn't direct the question to anyone particularly.
Okay, thank you. First and foremost, we have quite a number of policies in place that guide and protect, and some of the registrations that we have the Breast Milk Substitute Regulation and Control Act of 2012, which seeks to prevent infant and young child illnesses through death that come through because of lack of proper feeding. And this helps us protect, promote, and support optimal breastfeeding and even timely complementary foods so that this child grows optimally to the way it's supposed to grow, to achieve its milestones and even get brain grow to capacity. The second one is the Health Act of 2017, and we have also seen the third one is the Employment Act of 2007 that makes sure that mothers get their maternity leave, which is 3 months maternity leave, and it also gives the fathers 2 weeks of paternity leave to support. And remember, those are the very critical first few days when a mother really needs support. She has just delivered, and so the father is also supposed to support so that this mother can establish breastfeeding and she can become strong to be able to now continue feeding her infant. And so you find that the Employment Act gives the mother the 90 days, and she can also take her leave, her annual leave, as part of immediately she's through with the maternity leave. She can also take, if she's willing, she can take her annual leave. And of course, on top of that, she is supposed to get now the breaks when she goes back to work so that she can have time to exclusively either do some expression and carry that milk home. And she can also be provided with the workplace support, whereby now, if we have breastfeeding places, then this mother is in a position to express her breast milk and carry it home. She is able, even if she's possible to bring her baby with her, she can have a place where she can breastfeed her baby. And this is where we have some of the institutions have developed what we call the crèches, where a mother can bring her baby with her maid, and she is able to have some breaks where she can go breastfeed her baby. And the whole day, when she's supported that way, she is free to feel comfortable working when she knows her baby is also safe. And if she's given time to go and breastfeed, to express her breast milk, it also helps her relieve the pain of staying with that milk and prevents her from what we call losing her milk if she stays with it without expressing it. And this promotes continuity flow of the breast milk. So policies are in place. We have the Health Act, we have the workplace support. We also have the BMS, that is the Breast Milk Substitute Act of 2012. And we have even the regulations, what we call the general regulations of 2021. So the government is really trying to put structures in place and policies and registrations to protect this mother and to support this mother so that she can maximally and optimally feed her infant. Back to you.
Amazing. Thank you, Faith. That was very comprehensive. Irene, do you have anything to add from the IHRM perspective on these policies or existing support?
Thank you. I think my addition would be the existing challenge, which is the lack of awareness in some quarters. While MOH has all these policies and guidelines in place, we still have institutions that are not aware, professionals who are not aware of some of the requirements of the law. At least the Employment Act, that one we have seen a greater uptake, especially on maternity and paternity. But we still have people who don't go for paternity leave, especially. Maternity is not such a major challenge. So, one, there's limited awareness. A second challenge is limited implementation. So there are those who are aware that we have these policies in place, these guidelines in place. Some even have domesticated policies internally for their organizations, but then it remains a policy on paper, so that we have a slow uptake in terms of implementation. Another challenge that is there is cultural barriers. We need to revisit some of our perceptions and our biases towards breastfeeding, towards women having children and still working and raising families. Those are conversations we need to have so that then we can have greater support, which is going to complement the existing policies and guidelines that have been provided by the ministry and government and other stakeholders. I think another challenge also is awareness of where to get help and support. There are NGOs that do this, what Maziwa is doing. So I think we need to collaborate further like we have, so that we increase this awareness, so that organizations, even the small, SMEs, know where they can get the support that they need.
Yeah, absolutely. Thank you so much, Irene. And I can see that our comments are starting to come in from a lot of users, that it's a great conversation. Susan, thank you for your comments about the WEMA breast pump. We really appreciate hearing feedback. And yes, it's great to have you involved in this conversation. So feel free to continue making comments, asking questions. We're here for you, and we're here to answer your questions as needed. So we've already started talking about some of the challenges that companies face. I think awareness, as you said, is a big one, Irene. I'd like to highlight the survey that we recently did. We did a survey of over 500 HR managers across Kenya, and we learned a lot about the existing support for breastfeeding mothers. And as you mentioned, there are policies in place. Women should feel empowered to ask for their rights in the workplace, but yet there is still a gap in terms of implementation. From our survey, which is a small sample size, but pretty representative, we saw that only 62% of survey respondents said that their company has, actually 62% of the company said their company doesn't have clear-cut breastfeeding policies. So that's a pretty high number. Over half of companies don't have a clear-cut policy. And then 73% of respondents said that their company doesn't have a dedicated lactation room, despite it being part of the Health Act law. So obviously, this is something that needs to improve. We need to increase the implementation of some of these policies. But I'd like to understand better, perhaps from the employer's perspective, the HR manager's perspective, what are the barriers? What makes it challenging for companies to invest in this? And maybe what are the myths around those barriers? I think you mentioned one thing around lactation rooms not necessarily being as expensive as you might think. So, what are the perceived barriers, and maybe what are some of the real barriers that employers face in this journey? And Irene, I'll go back to you.
Thank you. I think one of the barriers that is very obvious is the element of cost. So that when people hear a lactation room, they probably imagine a very elaborate space that has almost like a nursery school, kindergarten kind of setup. That means you bring your employees and their nannies to the workspace. You have to make provision for extra employees to man that space and all that. There are organizations that have the capacity to do that, which is good. And I'm sure it's one of the benefits that attracts their employees to work for them. But then if your organization does not have that, it's bare minimums. Get a dedicated space that is well lit, that is aerated, have a comfortable seat. I'm sure Dr. Faith will tell you the bare minimums. Have a storage area, have a sink and a power source if they probably need to use a gadget that is powered. So if we all, put the cost aside, and even though you do the cost benefit analysis, then you would see this investment has a return, because then you will have mothers who are a lot more comfortable, they feel well taken care of, therefore their productivity improves. Another challenge would be probably the uptake. Leadership maybe does not view this as a priority. Another thing we have seen also, and which we have sensitized HR professionals about, advocate for these things. Don't go and make a board paper, make that presentation, and they say no the first time, then you're like, you know what, I'm not doing this. And most of HR professionals, over 65% are women. Yeah. So more or less a good number of them have gone through the breastfeeding journey in their work life and faced some challenges. You will be surprised. Someone thinks this is a privilege, and they're like, us guys worked, we had babies, we did not have lactation rooms. What are you millennials and Gen Zs talking about? So it's not about a generation. It's a right one. Madam just talked about the baby has a right to get their food. Yeah, it's a right for this employee to work in a safe environment where they feel taken care of, and it's also the right thing to do. If nothing else, it's the right thing to do because we all come from mothers, and if we did not have the opportunity to breastfeed, we probably would not enjoy the health that we do. So we need to, and that's why I spoke about cultural issues. We need to address the issues around having children, childbearing, and the challenges that come with it, the compromises that we have to make. If it means having policies that allow women then to have flexi hours, so that if I come in at 9, maybe I'll have express at home, and then I will only need to use this space maybe once in a day during the 1 hour break. Then I can probably leave early. Can I work from home? The world has changed, so we need to think differently. And more women, like I said, we cannot talk about women not working. More and more women are in the workforce, contributing significantly. Therefore, our workplaces have to be conducive and support this significant percentage of our workforce.
Absolutely. Thank you for sharing. Millie or Faith, do you have anything to add to that in terms of the challenges from the company's perspective?
I think I'll go, and I'm excited about what Irene has said, because many times the older employers think, what are you fussing about? I struggled and I did what I needed to do. I used to express the milk and pour it in the sink. So why should we have a designated space for you? What is so special about your breastfeeding now in this generation? But things have definitely changed. We are aware that it is of benefit to ensure that we're exclusively breastfeeding our babies. So not only for the 6 months, but even up to 2 years and beyond. But I also feel we also need to create awareness, and awareness about among the male gender, among the men in the workplace, who sometimes may be the ones who are discriminating the women against use of the room and even the need for the room. So creating awareness by bringing experts, lactation educators, such as those who are part of the Kenya Association for Breastfeeding, to be a part of education and training. What's the importance for breastfeeding? Why are we pushing this, even as the Ministry of Health is pushing and ensuring that the Health Act is adhered to and people know their rights? Why is it important? We'll have happier mothers who feel valued in the workplace, who feel supported, empowered, and then that translates into ensuring that they work much better. And when mothers and women feel supported, they definitely do much better. And for sure, it is their right. So we need to sensitize the entire workplace. Not only the women, but even the men need to be aware as to why it's important to create these spaces. And again, it's not that complicated. They tend to think that the cost implication is very high. But as Irene has alluded to, all you need are just the basics: a very good space, clean, comfortable, good sitting area, a fridge for storage, water flowing that they can be able to clean and store their equipment and ensure that they're expressing milk in a hygiene manner, and being able to store what they need to and then carry it home with them. So I think some of these barriers can be taken care of, and ensure that even in the workplace, we ensure that those figures improve, because 73% of those not having a lactation space are high, but there probably is a lot of a lack of awareness, and maybe those barriers of thinking of the cost implication that is involved. Thank you.
Thank you, Millie. And we're going to be talking a lot more about how the four of us on this call can also support employers in implementing some of these policies in a little bit. But what I'm hearing so far is that it's a human right, it's the law, it's a good investment from a company perspective, and it's the right thing to do for our community and our society. So sounds like a no-brainer to me. Now, I'd like to look at things a little bit more from the working mother's perspective. They always say that women can't have it all, or if they can have it all, they can't have it all at the same time. And so I want to talk about a little bit of the challenges that moms face. What are the barriers that they're facing in the workplace? And maybe, each of you can speak to your personal experience. Millie, you can speak to your experience counseling breastfeeding mothers. But we easily say, oh, you can use the lactation room and express your breast milk, but what are the hurdles that come along the way in this mother's journey as she returns to work? And anyone can start.
If I may talk, thank you. Some of the challenges the mothers are facing mainly is the support from their colleagues. I think if everyone is sensitized about the workplace support, then if they can support their colleagues by giving this person those breaks, the nursing breaks where she can go and do the expression and the space to do that, I think the mothers would do a marvelous job, because it's up to people understanding the value of breastfeeding and what the impact it has on the child's nutrition and in terms of the child's health and the future person who should be a very productive person in the society. So that way, if the colleagues are able to give what we call social support, so that, for example, if I may give an example in the health sector, where we have nurses working in shifts, sometimes you see, because of the shortage of staff, no one wants to leave this other person to go for like 40 minutes to be away to go and express, because you feel that the duties of that person are going to be loaded on you. So I think it is an issue of understanding and creating that space for this mother who has just given birth, who has come back to work, who is ready to work, so that she gets those nursing breaks to go and express her breast milk, so that her milk doesn't disappear and she's able to take home that milk to the child, because this milk can be even stored even without a fridge. It can stay for 8 hours. So it's just that social support. That is one of the major things that I know is really hindering.
Yeah, that's a very good point. Often it's just maybe a little bit of the embarrassment or some of the challenges around publicly expressing breast milk if it's not something that your colleagues are familiar with. We have an example of a woman who was a construction site worker, and she was trying to express milk at the construction site with all of her male colleagues. And you can imagine that can be maybe a little bit embarrassing. And so as men, as coworkers, as colleagues, what can we do to better support our mothers? Millie and Irene, anything to add in terms of the challenge from the mother's perspective in the workplace?
I'd go ahead and say there's a challenge of maybe the time constraints, not realizing that she doesn't need to have a whole hour at a time to express her breast milk. All she needs is about 15 to 20 minutes per session to express, but she imagines that she needs so much time to be able to pump the milk and keep it away for her baby. So because she feels the time constraint is too much, the mother opts not to do it. And there's also the challenge of maybe not having the information, the awareness of how to actually express. Why does she need to express? For what reason does she need to express? There are many myths and conceptions that end up becoming barriers to these mothers using the lactation space if they don't have the awareness. So I don't know if you want me to go ahead and talk about that, or I wait for Irene to share hers.
Anything to add, Irene? Otherwise, we can have Millie share some of her resources and support.
I can only add one. The logistics of having to store the milk and transport it home. But I like what we already said, that this milk can stay up to 8 hours. So that is not a major concern. If you express at lunch hour, for example, by the time it's time to go home, I think that's less than 8 hours. So, or even more reason why refrigeration and all that should not be one of those excuses or challenges. I think Millie can take it up.
Yeah, Millie, it would be great for you to share a little bit, just the basics on expression, and then also maybe a little bit on the storage rules, because I know it can be complicated depending on what temperature you're in and things like that. So that would be helpful.
Yes, thank you. And Faith has mentioned, yes, the milk can stay, pumped fresh milk can stay out in a cool area for 6 to 8 hours. So even if there's no fridge where the lactation space where you are, then you can store it in a cool place. But there are also areas where it's too hot. And of course, if you're thinking of Wajir or out in the coast in Mombasa, then 6 to 8 hours would be too long. So maybe about 3 hours or 2 to 3 hours because of the environment is a lot warmer than maybe a different place or county. Now, I also wanted to speak on mothers lack awareness of actually how to express and why should they express. There's also misconceptions about why am I expressing, and some believe that if they express, then they're not saving the milk for their baby who is at home. They believe that emptying the breast while they're at work reduces the amount for the baby who's at home. And this is actually a misconception. It's a myth. It is not true. What is known that is the more you take out from your breast, the more milk will be made. But if you're choosing to keep your breast full to save the milk for baby who is at home, you end up having the negative effect where your body will realize, wow, we actually are overproducing. Not much milk is being taken out. So the supply definitely dips. So many times people think their supply is dipping when they go back to work, mainly because they are stressed, but it's because they're not removing the milk. You need to remove milk to make milk. Now, the other thing is a lack of information of how to pump. How do you use a breast pump? How do you even use hand expression, the manual expression, if you don't have access to a breast pump? But then there are moms who tell me they think that use of a breast pump causes breast cancer. Now, that's something that some cultures believe and is something that we need to debunk as lactation professionals, as lactation educators, because then that is not true at all. So there's that limited knowledge is causing a lot of barriers to ensure that mothers are actually expressing the milk and storing it and keeping it for the baby. When we go back to storage, if you have access to a fridge, you have a space that you have a fridge, then you can keep it in the fridge for 4 days and it can stay in the freezer for about 4 months. But you're not going to leave it in your work freezer for the 4 months, or preferably not for the 4 days. You are going to keep it in the fridge if you have a fridge, but carry it home in a nicely, in a container that has a lid, and take it to your baby who you can either feed or continue breastfeeding up to 6 months and beyond. We want our babies to breastfeed for up to 2 years and beyond. And the beyond could be even for 4 years. It just depends on the mother and the baby and how comfortable they are to continue breastfeeding. But here, as I represent Kenya Association for Breastfeeding, we advocate for breastfeeding for those for that length of time. Thank you.
Thank you, Millie.
Maybe I can add something to what Millie has said. Breast milk does not spoil just like the animal milk, because breast milk has protective factors. It has antibodies. It has those protective factors. So it doesn't spoil like the cow's milk or the animal's milk. So that's why it takes a bit longer to not to go bad. And therefore, it's possible for a mother to express and take her milk home and then go and store it either in the fridge if she's not using it immediately. And sometimes we also say that if it has taken a bit long for the mother to reach home, she can feed the child with that milk first, so that then she can express the fresh ones which she can put in the fridge. So breast milk, if one understands the relevance of breast milk and its importance, its impact on this child, protecting the health of this child, ensuring that this child grows healthy, then people should be in a position to assist this mother get that opportunity, get that privilege, give her space and give her time to do so. After all, it takes only about 30 minutes at most. And according to the Kenya Employment Act, this mother, and even our Kenya Health Act of 2017, she is supposed to get at least 60 minutes, that is 1 hour, plus her other benefits of other breaks, her lunch break, plus her other tea breaks and all that. So if she gets that time, she has adequate time to express. then what Millie has said is very correct. We need to demystify the issue of, some people think when they express that milk will go bad, that milk will finish from the breast. We need to demystify that. And it takes a lot of awareness. Last year during the World Breastfeeding Week, we did a lot of creation of awareness, even to our parliamentarians, employees. I remember the human resource were also done a bit of creation of awareness about the support of workplace. So a mother just needs that space, that time, and she'll be able to express her breast milk. And breast milk production depends on the hormones. So the more you remove, the more you get more. So if all mothers understand that, and mostly from our public health facilities, you find that mothers have that knowledge. But the mothers who go to the private hospitals and private practitioners may not have that privilege to have that knowledge. And I think it's the high time we sensitize all and each and every health sector person, whether public or private, so that they get to know about that issue. Thank you.
Thank you. Yeah, Faith, I think I want to add on to that and explain that 1 hour to those, our audience. The 1 hour can be broken out into either 2 sessions or 3 sessions. So if you choose to do 3 sessions while you're at work, you can do 3 20-minute sessions in separate intervals. It could be every 3 hours, you're doing a 20-minute session. Another 3 hours, you do a 20-minute session of expressing. Or if you don't want to do that, you can still use your hour, but in 30-minute slots. So that's it. That is super important. And for the healthcare workers, there is also need to create awareness among the mothers they support, wherever they support them in the clinic. They know this mother is going back to work soon, so it's good to sensitize the mother and encourage expressing, because sometimes because of the cultural myths that people have, even among the healthcare workers, they may not encourage expression of breast milk so much when the mother is at work. So that also creates a bit of a barrier to prevent the successful exclusive breastfeeding among the women in the workplace. So that's all I just wanted to add. Thank you.
Thank you both very much. This was a lot of very helpful information. We're soon going to start taking questions from the audience. So if you have questions, please drop them in the comments. We're getting some great comments so far. Thank you, Priscilla. She's shouting out to Millie. But please feel free to ask any questions you have for any of the panelists. In the meantime, as you've shared all this information, I would like each of you to share, how can people reach out to your organization? So if it's a working mother looking for lactation support, if it's a company looking for breastfeeding policy development or understanding the regulations a bit better, what resources do you provide that can be helpful, and how can maybe people reach out to you? And maybe we start with Millie in terms of the counseling and all the great info you just provided.
Okay. So we, as Kenya Association for Breastfeeding, are a membership association, and we have professional lactation educators, lactation counselors who support mothers in the community through their breastfeeding challenges. So these are from newborns, mothers who are having challenges with either mastitis or low milk supply or very, very painful breastfeeding. We have the training, the skills, the technical skills and expertise, fully educated in terms of lactation education, to be able to support these women in the community. So even if we go into the workplace, we also can provide lactation education, creating awareness and advocating for the mother who goes back to the workplace. So this is creation of awareness to the employer and at the same time to the employee. So for this woman to know, how do I express? What's the benefit of expressing? How do I ensure my milk supply doesn't dip when I go back to work? And it's not only a one-off education. So I'm saying that Kenya Association for Breastfeeding can carry out different sensitization talks in these organizations to continue that momentum, to avoid this discrimination for women who seem to be lactating and are found to just be a bit too much or cumbersome or too sensitive, who need to just be kept away. We need to support these women. They need to feel valued. They need to feel empowered. And we as the Kenya Association for Breastfeeding are fully equipped with our skills and are passionate in supporting, promoting, and advocating for these women. Thank you.
Thank you, Millie. Faith or Irene, would you like to continue adding about your specific organizations?
Yes, I think I can go next. And I am thrilled to listen to the two experts speak about this. I like what Millie says, that you actually could be doing it wrong and you don't even know that you're doing the wrong thing. I'm also keen to see that there are people who will not want to express, even with the lactation rooms being provided because of the cultural issues. So at IHRM, we are about sensitization, awareness creation, capacity building for our members, because if we're going to have workplace advocacy, then we need to equip HR professionals to have the capacity to, one, appreciate some of these details so that they can support their employees when they come back to work. Number two, so that they can have the proper policy documents. We have the expertise and our members have the experience. You can even benchmark with organizations that have already set up lactation rooms, have the policy guidelines in place, and are actually implementing for that. And thirdly, we can be a linkage for HR professionals out there to the different experts, because IHRM collaborates with like-minded institutions like we have in this case, the Ministry of Health. We have collaborated with the Ministry of Health on mental health issues, which we do also with Chiromo Hospital, and our members can get psychosocial support. We're also happy to do this now with the Kenya Breastfeeding Association and Maziwa and MOH on this issue. So even with our partners, we are happy to bring professionals together, increase their awareness, and collectively enhance breastfeeding mothers' experience at the workplace.
Thank you, Irene. And we're getting a lot of great comments in the chat right now. I love this success story that was shared by Priscilla that we've posted up here, but an example of Aga Khan Academy providing a lactation room for staff and visiting parents. So that's great to see that it's happening and it's not too expensive or difficult to do. Faith, would you like to share, in terms of the workplace task force, what are you working on? What resources are available for both employers or mothers?
We have both the policies and guidelines in terms of workplace support. And for more details, one can reach out to somebody called Purity at the Division of Nutrition at the MOH office. I can give the number on the chat so that you can share. There is Caro, Aremi, and there is also Purity Wahinya. Those are the two who are managing the program of maternal, infant, and young child nutrition. And the guidelines and the policies are there in place in case somebody wants to get more information.
Thank you very much, Faith. And it's really great to see that there's a task force specifically dedicated to workplace support. In terms of Maziwa's involvement with all of these different partners, we're very excited to share that the study that we have just done on the state of breastfeeding support is going to be published right after this webinar. And it gives a lot of information about a lot of the topics that we're talking about, both in terms of the challenges that both mothers and employees face, but also in terms of the resources that each of these organizations can provide to companies and to mothers to help with that. So along with this webinar, we'll be sharing that as well. So you can all take a look at those links and reach out to the relevant contacts. Our organization has launched the WEMA breast pump, as I alluded to before, and its discrete, wireless, and portable design can be used in a variety of workplaces. And we actually have a corporate package where employers can purchase communal breast pumps where just the motor and the cooler is shared, the breast milk cooler and the battery operated motor. And each woman receives her own breastfeeding pump parts so that it's very safe and hygienic and very affordable for the employer to support mothers. And we found that this has worked well with employers who have small companies, large companies that are spread out. even exploring launching this at tea farms and flower farms where there's thousands of employees very, very spread out across a farm. And so if you're interested in that, definitely feel free to reach out. Our website is maziwabreastfeeding.com. And so I think each of us have a role to play, whether it's social enterprises, lactation consultants, HR managers, the government. We are all working together to try and solve this problem. So as a working mother, if you do feel like sometimes you feel alone, you're not alone, and we're all here for you, and we're all here to support you. I'd like to thank you all again for all of your comments. If there's any questions for the panel, I will definitely ask you to share those questions with us. As we wrap up the call, we can take any questions that you might have. But as we wait for questions to come in, I think what we'd like to close with is maybe one key takeaway or one action item that you would like the audience members to remember after this webinar. I know there was a lot of information shared, quite a few challenges, quite a few benefits, but what's the one thing that you would like people to remember after this call? And maybe we can start with Irene first, not to put you on the spot.
That's okay. I think for me, I'm making a business case for having a conducive workplace that is friendly for breastfeeding mothers. It enhances their productivity. It lowers your costs on recruitment because you reduce your turnover. You don't lose your staff. They are better engaged because they feel well taken care of. It contributes to their well-being because they are a whole human being coming to work. They are mothers, they are women, and all that affects how they contribute to the organization. And if you take care of that, then you take care of their other worries back home. They feel supported, and they certainly support your business. So I would encourage HR professionals to speed that to champion. I think to be champions of breastfeeding mothers and support them, have in place the proper policies and regulations that they require. And as IHRM, we're always happy to support them to achieve that. Thank you.
Thank you very much, Irene. Maybe we go back to Faith. What's one takeaway?
Yes. Yeah, my take is that it is possible to have workplace support. All employers need to do is to set a room, provide a sink for washing their hands and soap, and ensure that they also have some cupboard and a fridge if they are able to get, which I know many people are willing even to support by providing one. And they also need to have a place where there are some electrical outlets for the mothers who will come to do pumping with the breast pumps, and a small table and a comfortable chair to sit on when they are doing expression. You may not need so much. After that, you can now enlarge the room and give it more equipments like even IEC materials, and have a TV where a mother can sit and express as she's also looking at some programs. Thank you.
That's very nice. Yes, thank you, Faith. Millie, from your perspective, one action item, one takeaway for the audience?
Yes, one takeaway for the audience is to realize that they can advocate for themselves. They can be able to go back to the workplace after maternity leave and ensure that they are advocating for themselves, because it's their right to have that protected time of 1 hour on top of their lunch break to be able to ensure that they're able to express breast milk for their baby who's at home. But I also realize that it takes a concerted effort, that we must all work together, the healthcare professionals, the human resource managers, the communities, the mothers, the breastfeeding educators, the ministry, so that then we're able to normalize this in the workplace, to normalize breastfeeding, and where mothers are supported, their infants and their children are supported, so that then we have a healthier nation. Thank you.
Thank you very much. Yes, these have been great takeaways and great action items. The action item I have on my side is that we have spent some time, all of us partners, in conducting this survey and in sharing resources in terms of the links, the guidelines, both for working mothers and for HR professionals or companies. And so we'll share the link to this survey as well as the resources along with this webinar. So I would highly encourage you, if you are interested in this topic, if you're facing these challenges, Please check it out and read the report, and we'll include contact information and websites for all of us as well. So if that would be my main takeaways, please spend the time to do that. And we're all open to support you in this journey. This has to be a collective effort. We need to be supporting our mothers who are supporting our children, who are supporting our future generations. And this is not just a women's issue. So that's my key takeaway. Anything else to add to close the session? I don't think we have any questions, but I just want to thank you all again for your engagement as panelists. I would like to thank all the audience members who have given us such engaging and thoughtful comments. We're looking forward to reading them all after this call. And just wanted to give my deepest thanks for participating in this. Anything to add from any of you to close the session? Otherwise, we can wrap a couple minutes early.
Thank you. Just to say thank you to you, Saha, for moderating so well, and for the privilege of being on this panel with Faith and with Irene. We can definitely work together to ensure that these mothers are supported in the workplace. But I'll also add that Kenya Association for Breastfeeding is there to support any mother who may be struggling in her lactation journey, wherever she may be. Thank you.
Thank you.
I'm also happy to have interacted with all of you. I think if we support one another from the ministry point of view, ministry can't do it alone. And that's why we have people like Miri and Irene. So it is, and yourself, Sama. So if we cannot work together, I think we shall make our mothers feel more comfortable. They shall feel protected, because like the private companies, they don't give the 30, I mean, the 90, the 3 months maternity leave, they give shorter periods. So if we work together and fight for these women, I believe we shall have children who are very healthy.
All right, allow me to also thank the ladies. It was an all ladies, it was a ladies affair. We are tackling women issues after all. Thank you
Yes.
for the engaging session, and thank you for collaborating so that we can get some of this data. I think we also need to keep doing more surveys and research so that it's backed by data. As we advocate at the workplace, then we can justify, especially the cost-benefit aspect of supporting breastfeeding mothers. Thank you also for the participants who joined us on the call. I'm at the Women in HR convention in Mombasa. We have close to 150 women having great conversations about purpose, resilience, and equity. And so I am just grateful that we are aligned in supporting women. Have a good evening.
Thank you all. Have a great evening. And it was so nice to speak with you all. And we look forward to continuing the conversation, maybe with a man next time as well. But happy Women's History Month to everyone. Enjoy your conference. I'm glad that there are conversations like this happening because they're very important. Good night, everyone.
Thank you. Bye-bye.
Bye.